All right, first the heart is covered by a pericardial sac. That pericardial sac on the inside has a parietal pericardium, and there's also a pericardial space, and that is filled with pericardial fluid. Now, covering the heart, you have a pericardium.
Visceral pericardium.
It's it's called a visceral pericardium or an epicardium. So that's this outside part right here. This inner part right here is called the myocardium. And the inside part, not the ridges, but right below the ridges, is the endocardium. Now, let's orient ourselves to the heart. We have the apex of the heart, so that tells us this is the bottom. Another big identifier is, you can't quite see on this one, but there's going to be a line right here, and that's the coronary sinus. And so you know, if this is the bottom over here, and you know this coronary sinus, you know down here are the ventricles, up here's the atrium. The coronary sinus goes posterior to the heart, so you can turn it around, and you know you're looking at the anterior side, and it's facing down. And that's how you know the orientation of the heart. So let's start off. We're going to go via blood flow. You have a big vein up here, which you can tell is supposed to blue in color. And you can see there's another one coming down from here, and there's another one in there. And there's the superior vena cava. Down here is the inferior vena cava, coronary sinus. They're going to enter the right atrium, which is this area here. Right above, and as you're looking at it, lateral of that atrium is the right auricle. It looks like a little ear. There's one on the other side as well up here. So inside the auricle are called pectinate muscles. This is ridges. The right atrium, as you can tell, is smooth. In fetuses, this is before they exit the womb, there's a hole right here, and it's called the foramen ovale, and that transports blood over to the left atrium. Once it takes the first breath, the pressure differential turns it into the fossa ovalis. Now from the right atrium, the blood's going to keep on flowing through the tricuspid valve. The tricuspid valves consist of papillary muscles, which are these red ones right here. As you can tell, 40, 42, 40, or whatever that number is. And they're connected to this valve via chorda tendinae, and that makes up your tricuspid valve. These ridges right here are going to be the, give me 1 second, trabecula carne. Trabecula carne are these ridges. Now the blood from those ridges are going to go from the right ventricle through this semilunar valve, which is also referred to as pulmonary valve, into the pulmonary trunk. From the pulmonary trunk, the deoxygenated blood is going to keep on traveling to the lungs via the left pulmonary artery and the right pulmonary artery. Now here, in an adult heart, you're going to see a ligamentum ligamentum arteriosum. In fetuses, and after a few days old, it's a ductus arteriosus, and that helps provide, remember this is in a fetus, this is going to be oxygenated, and it'll take it straight to the aorta arch. But after a few days, it turns to ligamentum arteriosum. So now it's going to travel over to the pulmonary, via the pulmonary arteries to arterioles, to capillaries in the lung. There's going to be a gas exchange. It's going to oxygenate the blood. It's going to go to venules and then to pulmonary veins. Here's two here. These are the left pulmonary veins. And inside the atrium, you can see the right pulmonary veins into this left atrium. As you can tell, there's the auricle, there's the pectinate muscle. Here's smooth, that tells you the left atrium. It's going to go into the bicuspid valve. Again, the valves what is also referred to as the arterioventricular valves, AV valves, consist of papillary muscles. Since this is the left side, is going to be, and it's the bicuspid valve. You have two papillary muscles, and you have the chorda tendineae that connect the muscles and make that valve right there. This is the inside of the left ventricle, and that is the trabeculi carneae, and it's going to go to the the aortic valve, which are semilunar and are in here, into the ascending aorta, which is here. You have the ascending aorta, the aortic arch, and it comes down to the descending aorta. Up here, you have the first one starting from the right side of the heart, and it's going to be, this is not to scale, it's actually bigger. It's going to be the brachiocephalic trunk, and the brachiocephalic trunk is going to break down, it's going to further separate into the right subclavian artery and the right common carotid artery. Now imagine the subclavian splits here. Just above it right here is going to be the right vertebral artery as well. This middle one now is the left common carotid artery. This left one, in reference to the heart, is going to be the left subclavian artery. From those arteries, they're going to travel over to arterioles, to capillaries in the body tissue where the gas exchange is going to occur. And then it's going to go into venules, to veins, and those veins are going to culminate again in the inferior vena cava and the superior vena cava. All of this heart rests on the mediastinum, the end.